Living with type 2 diabetes. Pregnancy and type 2 diabetes. How can diabetes affect my baby? If your blood glucose levels are high around the time of conception and early pregnancy, your baby has a higher risk of developing abnormalities to their heart, spine and kidneys. If your blood glucose levels are high during later pregnancy, your baby has more chance of becoming very large. This can cause problems during delivery, becoming very small, being stillborn, developing very low blood glucose levels immediately following birth. What can happen to me and my diabetes during pregnancy? Having diabetes increases your chances of developing high blood pressure, hypertoxemia. If you have existing eye damage, retinopathy, this may get worse. Your body's need for insulin will change and almost certainly increase throughout the pregnancy. During pregnancy, you will be cared for by a specialist diabetes and obstetrics team during your pregnancy. The team is likely to include a diabetes specialist, an obstetrician, a midwife or specialist diabetes midwife, a dietitian and a diabetes nurse educator. You'll visit your team fortnightly to weekly, depending how things are progressing. Blood glucose testing. You will need to test your blood glucose levels very often during your pregnancy. Most people test between 4 to 8 times a day during pregnancy. The target range set for your blood glucose levels during this time are likely to be lower than your targets before pregnancy. This is because women without diabetes tend to have slightly lower blood glucose levels during pregnancy than at other times. The aim of blood glucose management for those with diabetes in pregnancy is to get as close to this as possible. You should also be alert to the increased risk of having more frequent low blood glucose levels, hypoglycemia or hypo. The risk of hypos inevitably increases when you are achieving lower blood glucose levels overall, and if left untreated, hypos can cause you to pass out. Laboratory tests. It is good to get frequent laboratory blood glucose and HbA1c levels during pregnancy. These are to back up the results you are getting on your own blood glucose meter. Some diabetes services like you to have fructosamine tests as well. These look back over your average blood glucose levels for the past 2 to 3 weeks. Taking insulin. You will have backup and support from the diabetes midwife or diabetes nurse educator and the dietitian to help you learn the skills you need to be on insulin. They will also give you advice on your insulin doses. These skills will involve eating regular meals and snacks containing carbohydrate food, how to inject and store insulin, how to avoid your blood glucose level going low, hypo, how to recognize and treat a low blood glucose level. Scans. Scans are a good way of checking on the baby's growth and development. They can also pick up on any problems developing. You are likely to have fairly frequent scans during your pregnancy. During labor and delivery. The aim with labor and delivery is to have a normal labor and vaginal delivery if possible. However, because you have diabetes, your medical team will be keen to avoid any problems developing during delivery for either you or the baby. Women with diabetes have a higher chance of needing a cesarean section than women without diabetes. Also, labor may need to be induced if your baby is becoming larger, your pregnancy is going over term, beyond 40 weeks. You will almost certainly need to go onto an IV drip during labor. The drip will have one bottle containing glucose and another bottle containing insulin. The rates of these drips will be changed according to your blood glucose levels. Your blood glucose levels will be checked at least every hour. When baby is born. Once your baby is born, you will come off the IV drip. You should be able to start eating fairly soon after delivery. Your blood glucose levels will be checked often. If they go up, you will need either diabetes tablets or insulin. Insulin is safest to take if you are breastfeeding. However, once you stop breastfeeding, you can consider diabetes tablets again. Your baby's blood glucose will be checked often in the first few days following birth. If your blood glucose levels were high during pregnancy, your baby might have been making a lot of its own insulin in order to process the glucose it was getting from you. Once this supply of glucose is cut off when the placenta separates, the baby is at risk of going low as it might temporarily have too much insulin. This is easily treated when it is picked up and is only temporary. Once you go home, it is important to stay in touch with the diabetes team until your blood glucose levels are healthy and you are settled on the medication you are taking for your diabetes.